The incidence of obstructive sleep apnea syndrome is increasing as the incidence of obesity is increasing. The prevalence of obstructive sleep apnea syndrome in Western countries is approximately 4% in middle-aged men and around 2% in middle-aged women. Let's jump right into our case. Today we have a face-to-face consultation. Mr. Smith, 45-year-old, comes in and tells you, "My wife is concerned about my snoring and choking noises while I'm sleeping." How would you approach this case scenario? In data gathering, what will you ask a patient to start the consultation? If you have watched previous series, you'll know that it's important to start with an open question, so you encourage the patient to tell their story from the beginning. "Could you tell me more about the breathing problem you've been experiencing, Mr. Smith?" Ideally, if you can get a collateral history from Mrs. Smith, it would be helpful, as it is difficult for the patient to tell you about the history of presenting complaint, as in obstructive sleep apnea, most of the time patients are not even aware about what's the problem. Having elicited the story, you might find that it's helpful to ask some close specific questions. You may ask Mr. Smith, "How many episodes have your wife observed in a typical night?" It's important to ask about witness apneas. Patients might not understand what does an apnea mean. So you might ask a patient, "Has your wife mentioned that you stop breathing for more than 10 seconds? Nice clinical knowledge summaries recommend to suspect obstructive sleep apnea syndrome in a person with any of the following symptoms: excessive daytime sleepiness and snoring and/or impaired concentration, witness apnea or choking noises while sleeping, feeling unrefreshed on waking, mood swings, personality changes or depression, nocturia, rarely nocturnal sweating, reduced libido, and gastroesophageal reflux disease." When you're eliciting your history, be sure that you explore the presence or absence of these features. Don't forget to ask about red flag symptoms such as unilateral nasal bleeding, severe nasal obstruction, change in voice or hoarseness, any dysphagia. These symptoms need to be taken seriously because it could be related to head and neck cancer. Exploring risk factors for sleep apnea is important in the history. Make sure when you're asking this question to signpost your question so that they don't sound formulaic. Also about smoking. Does a patient smoke? So you might say to the patient, "Our habits can affect our health. May I ask whether you smoke?" Also about drinking habits. Does a patient drink excessive amount of alcohol in the evening? Also about sedative drugs. Some patients may be taking sleeping tablets. Explore whether the patient had any problems with the tonsils, enlarged tonsil. Before the consultation, and make sure that you have glanced at the patient's record and look at the past medical history. Does the patient have any history of obesity or any history of ENT surgery? These are relevant in a case of obstructive sleep apnea. Exploring the psychosocial impacts is critical in this case scenario. Also about driving and work performance. If a patient suffers with obstructive sleep apnea, chances are that they are not having restorative sleep, and this is impacting on their daily activities. They might find that they are more grumpy, they might find that they get more sleepy during the day, they might find that this is also having impact on their relationship with the wife. For example, if both the wife and the patient are sharing the bed, and the wife is having these noises and is scared about husband, then it could cause some stress in the relationship. So make sure that you explore the dynamic in the relationships, also about the mood, also about sleeping, and also about social life as well, because it's important to know whether the patient has a good support network. If the patient tells you that they have been more sleepy during the day, then make sure that you explore about the sleepiness. Excessive daytime sleepiness may cause accidents at home or at work or whilst driving. You need to ask about the patient's occupation. Depending on their occupation, it may impact on their ability to work properly. For example, if this patient is a lorry driver or a pilot, then there will be implication to their work. Use of interpersonal skills is important in this consultation. I'm sure you know about the importance of exploring patients' health belief model. The patient's agenda, the wife agenda needs to be explored. When you ask about patients' ideas, concern, and expectation, make sure that You ask it in a way that's natural. Don't try to force it. Picking up on the patient's cue is important. As you remember, the patient said to you that they came in because of their wife. So it's also important to know what's the ideas, concern, and expectation of a wife. So this patient may not be worried at all and think that they may be wasting the GP time. Chances are that it is a wife who has been persuading the husband to come in to get a check, and they would like something to stop the snoring or choking noise. That's why they wanted the patient to come in. And the patient may not be worried at all and think that he might be wasting the GP's time. So it's important to know about the health belief model of the patient and the health belief model of the wife in this case scenario. The next step is examination. What examination will you perform in this patient? If you suspect obstructive sleep apnea syndrome, it might be worth checking the patient's blood pressure, weighing the patient and calculate the BMI, examine the neck and measure the neck circumference. A neck circumference of under 37 cm is low risk for obstructive sleep apnea. However, if it is above 48 cm, then it is high risk. Also examine the nasal passage for any blockage. Examine the tonsils whether they are enlarged. Once you have examined the patient, then you may also want to ask the patient to complete an Epworth Sleepiness Questionnaire. Investigation is usually recommended when the score of the Epworth Sleepiness Questionnaire is greater than 10. In the context of the RCA, make sure that you don't dwell too much on data gathering at the expense of clinical management. Most candidates fail on clinical management because they don't give enough time for clinical management. So it's important that you transition the consultation at around 6 minutes. If you have taken a focused history covering the biopsychosocial model and examined the relevant system, you need to make sure that you have a list of your differential diagnosis. Let's assume that you think that this patient have obstructive sleep apnea syndrome. You need to explain the patient in simple terms what it is. Patient.info provides information about how to explain condition in simple lay terms. So for example, in obstructive sleep apnea syndrome, you might say to the patient, this is when your breathing stops for short spells while asleep. It occurs because the throat muscle relax and become floppy such that the airway is narrowed or a temporary blockage is caused. When the airflow is restricted, your blood oxygen level decreases. Your brain will usually wake you up to make an extra effort to breathe again. You will normally go off to sleep again without being aware that you have woken up. So this is a simple explanation you may give to the patient. Depending on the severity of the symptom and the patient's occupation, your clinical management will vary. If you suspect mild obstructive sleep apnea syndrome with no daytime sleepiness, then you might consider lifestyle modification to treat this problem. Lifestyle modifications include smoking cessation, weight loss if the patient is overweight or obese, and reducing alcohol intake and sedative use such as sleeping tablets. If the patient sleeps supine, advise the patient to try to sleep on their side. Mandibular advancement device is also something that you might consider if a patient has mild obstructive sleep apnea syndrome with normal daytime alertness. Depending on your assessment, you may also refer to a sleep center for confirmation of the diagnosis using sleep studies, and if the patient suffers with severe obstructive sleep apnea syndrome, then they may require treatment from secondary care, for example, continuous positive airway pressure. Make sure that you also advise about driving. What advice should you give about driving? The British Thoracic Society, BTS, has provided clear guidance about driving for people with obstructive sleep apnea syndrome. If a patient is being investigated or have a diagnosis of sleep apnea but does not experience symptoms of daytime sleepiness that are of a severity likely to impair driving, then that person does not need to stop driving or inform the DVLA. The person needs to inform the DVLA if they're successfully using continuous positive airway pressure or intraoral device. As long as the person is compliant with the treatment and the symptoms are controlled such that they no longer impair driving, the license should not be affected. If a patient is diagnosed with obstructive sleep apnea syndrome and the symptoms include sufficient sleepiness to impair driving, or prior to formal diagnosis, the person is reporting sufficient levels of sleepiness to impair driving, and there's a reasonable chance that this is due to a medical condition, then the person has a legal requirement to inform the DVLA and stop driving. Be sure to safety net advise your patient to seek medical attention if symptoms do not resolve with treatment, and consider arranging a follow-up plan. Thank you for watching this video till the end. If you have any questions, any suggestions, or any comments about how you would approach this case, please let me know down in the comment section. I look forward to reading your comments. If you found this video useful, I've got 2 videos I want you to watch. The first one is RCA case on tiredness. We discuss how to assess and manage a patient presenting with tiredness. The other video is on assessing headache. This is a common presentation that we encounter in general practice. Click on the right if you want to watch the video on tiredness, and click on the left if you want to watch the video on headache. As always, make sure that you subscribe if you're not already subscribed and turn on notification bell. Take care everybody. Bye bye.